Eltrombopag tablets are a medication used to treat low platelet counts thrombocytopenia in patients with chronic immune thrombocytopenia or severe aplastic anemia. The active substance in tablets is Eltrombopag. Indications: Eltrombopag tablets are indicated for the treatment of low platelet counts thrombocytopenia in patients with chronic immune thrombocytopenia who have had an insufficient response to other treatments. They are also used to treat severe aplastic anemia in patients who have not responded to other therapies. How to use: Eltrombopag tablets are for oral administration only and should be taken as directed by a healthcare professional. The recommended starting dose of Eltrombopag tablets for adults with chronic immune thrombocytopenia is typically 50 mg once daily, with the dose adjusted based on platelet counts and response to treatment. For patients with severe aplastic anemia, the recommended starting dose of Eltrombopag tablets is typically 50 mg once daily, with the dose adjusted based on platelet counts and response to treatment. Eltrombopag tablets should be taken on an empty stomach, at least 1 hour before or 2 hours after eating. Contraindications: Eltrombopag tablets are contraindicated in patients with a history of hypersensitivity to Eltrombopag or any of the tablet's components. They should also be avoided in patients with liver disease or those who have experienced thrombotic events. Special instructions: Patients should have regular blood tests to monitor platelet counts and liver function while taking Eltrombopag tablets. It is important for patients to inform their healthcare provider of any other medications they are taking, as Eltrombopag may interact with certain drugs. Patients should not stop taking Eltrombopag tablets suddenly without consulting their healthcare provider. Side effects: Common side effects of Eltrombopag tablets may include headache, nausea, diarrhea, fatigue, muscle aches, increased risk of blood clots, thrombosis. If any side effects persist or worsen, patients should contact their healthcare provider for future evaluation and management. It is important for patients to follow their healthcare provider's instructions carefully while taking Eltrombopag tablets to ensure safe and effective treatment.